We are good to go, ma'am.
Hello and welcome in today's nursing webinar session. Myself Shanti, and we are going to talk about the organ donation awareness. And I think every citizen should understand the national organ donation process. Especially, it is very important for the healthcare professional. Let me also welcome Dr. Durgesh J, who is our senior consultant intensivist from Secunderabad unit. I welcome you, sir.
Good afternoon. Thank you.
Yes, and when we are talking about the slide, as everybody should know that the significance of 3rd August is marked as a National Organ Donation Day, and 13th August is going to be a world celebrating the gift of life, which is again on 13th August will be the World Organ Donation Day. So yes, and I'm very thrilled and excited to see this, the achievement. I request you to talk about this, sir. Could you just talk about this?
I am also very happy to share that our hospital, Yashoda Hospital, Secunderabad, has been nominated and won the best hospital in private sector for organ donation day. That this is because of our team's entire effort that involves our critical care consultant, neurosurgery, neurology department, our nursing staff, which are on their forefront in the monitoring, and not to forget our transplant coordinators who are very good to coordinate, and they are very active, and they are in pro for counseling part as well as understanding the attendance and counseling regarding what is mean exactly by organ donation and what is the next process and all. With this help, we could achieve this milestone. But I think there is lot of things, there is lot of scope for improvement. Then probably we'll try for a next level of our success.
Very truly, you have acknowledged, sir, and kudos to all the team. And first, we would like to again understand as we will be talking this session for half an hour, and by looking at these logistic, is there enough awareness about organ donation in India, sir?
The answer can be given yes or no also. No, saying that if you consider our overall national statistics, so previously our national statistic, the organ donation rate stands were like 0.05 per million population. Now it has increased. So it is around 0.8 million per million population. If you consider state-wise, Telangana state has the highest number of organ donation per million population. It stands in the range of 5.48. Then Tamil Nadu, and then probably Maharashtra and Gujarat states comes. If you consider as in India, definitely we have progressed from 0.05 to 0.8. But if you consider the Western countries like Spain, Austria, and other organ donation rate stats like 35 to 40 per million population. If you consider there is long way to go, yeah, definitely the awareness is coming up. There is a lot of more donations happening, but the rate at which happening, it needs to be more a boost up. The society needs more awareness. We have to conduct a lot of more programs, including in medical fraternity also, and subsequently to the society also.
Yes. So having said about this, now when we are talking about the significant increase in global burden of disease, again, we all understand chronic kidney disease and liver disease and heart diseases are very prevalent. Is a need for organ donation rising in the current situation? Because as in India, this is the second most populous country. What is your insight about this? Because of this burden of disease, I think the organ donation needs are also increasing in the community.
Yeah, so if you see the latest trend, what is happening is when as last couple 2 decades, what we see, the affluent society in India is increasing. At the same time, the disease process, chronic disease process like diabetes, hypertension, and they are also becoming prevalent, increase in the number. So what is happening? The patient is having with the chronic kidney disease, liver cirrhosis, or chronic liver disease, they are increasing. To the tune that when the patient landed in the end organ stage, the number of organ available for the transplantation is feeling quite short. So if you see kidney example, so probably in an year, we may need up to 1.5 to 2 lakh for the organ donation to supplement the existing disease condition. So available organs might be in the range of 10 to 15,000. Same with the liver. If you consider the data, there are a number of requirement of probably liver in a year in our country probably range in around 80,000. But the available organs are only in the range of 3 to 5,000. So there is a on one side, the disease burden is increasing. On the other side, the number of transplant, the number of organ donations are increasing, but there is not much at the pace which is the organs, the disease process are increasing.
And at the same time, population in the country also is increasing.
Yeah, yeah. So we are becoming probably we are becoming the most populous country now.
Yes.
So
So I think that is how, as you have said, long waiting list we get to see, and the high mortality rates among the population is so too
yeah, yeah,
increasing.
definitely.
And when we are talking about the organ donation in simple medical terms, because again, I guess this is going to be a very general session. So this is how the donation process happens in medical term, the process of surgical removal of an organ or tissue from one person to another who is going to to receive his recipient. So in which conditions can tissues be donated? Because all these years we were only understanding this vital organs only can be transplanted and to be donated. And is it a time sensitive process for the tissue donation, or it is just like like organ retrieval, it takes time,
So
same like
if
organ retrieval.
yeah, yeah, if we consider organ and tissues, like recently, as our understanding, and there are a lot of societies that they are clearing the tissue is also can be transplanted. So the only difference is that tissues can be made viable in the tissue bank up to 24 hours, sometimes up to 48 hours. Like cornea also can be transplanted in the patient who was having already blindness because of corneal opacities. The other thing, heart valves can be also transplanted. Heart valve can be stored in the tissue bank up to 48 hours. And those patients who are having any other valvular heart disease, there we can put them, we can transplant them. Other tissues which can be transplanted, considered can be skin in those patients who are having burn, or bone grafting, or bone where we need it. Tendon can be transferred, ligaments can be transferred, veins and nerves also can be transferred. The only transplanted. The only the difference is that we have to take it off. We have to store in the tissue bank. It can be stored up to 24 hours, up to 48 hours in case of heart valves, so that it can be subsequently utilized in the selective donor cases.
So here the logistic framework would be very great. I mean, any hospital, if at all they wish to do all such kind of things, I think logistic plays a very important role here. So having said so about the tissue transplant and all, so these are the organs and tissues which can be donated. Do you agree? I think you will agree also with the slide. And what conditions can the small intestine be donated? As this is a awareness session, and we have also mentioned small intestines also can be donated or transplanted.
Yeah, so as we, lot of organs can be transplanted, including small intestines also. Suppose the patient might be having any small bowel obstruction or short bowel syndrome, or patient is having chronic malabsorption syndrome, or patient is having any difficulty in absorption, or any localized malignancy, which is localized to probably to our intestine also. In that situation, we can transplant small bowel also. So other organs, like definitely we know that kidney, liver, heart, lungs, these are the routine organs which can, these are the more common organs which can be transplanted, even pancreas. So pancreas also can be transplanted. On the top of that, pancreas along with the kidneys also transplanted. So in situation where liver and kidneys, so suppose probably in condition where the HRS kind of condition, where the both the liver as well as suppose the kidney can be also have a transplantation. Dual organ transplantation is also possible. So there are, it has been said that probably 7 to 8 solid organs can be transplanted if you consider transplantation.
So, having discussed about that, and when we are going to talk about the criteria, one must also know the criteria about organ donation. And we have described into two, which is eligible and non-eligible. Now, the question would be, what are the eligible criteria for organ donation? We have discussed, and how are patients managed, falling into the non-eligible criteria?
So look, recently there are like where as our understanding has progressed. So usually we consider as a particular specific age for the cutoff for the organ transplantation. Now when our understanding has improved regarding the organs, so any patient irrespective of age or up to 70 to 80 years of the age also we can transplant the organs. provided that before transplantation we should have a thorough evaluation of the organ. Suppose if liver we are considering for the transplantation, if the patients like liver functions are good, no history of any other liver disease or no history of any viral hepatitis, this or liver can be good as a transplantation. Considering heart for the transplantation, if we do an echo, even if transthoracic echo, they can be considered good for the transplantation irrespective of the age also. So and this same with the kidneys also. But in case where there is we cannot do the transplant, especially in the active retroviral disease or HIV disease or any Creutzfeldt-Jacobs disease or any previously malignancy, which is probably metastasis disease, there will should not be considering a transplantation. Sometimes what happens is the patient land up in sepsis and septic shock. Sepsis as such is not an absolute contraindication for the transplantation, but the patient who is requiring higher inotropic support, probably dual vasopressor support, their organs are ischemic. In that situation, we may not able to transplant that organ. Other thing is that because of hypoxic ischemic insults, the organs take a hit, take a damage, whether it will be liver, say it will be kidneys on. In that situation, then probably we reconsider the decision of the organ donation transplantation. In that situation, what we do on table, probably a transplant surgeon take a decision. They take a sample biopsy. They send the organ for the interop their biopsy, and they find out where the microscopy and histology and everything is in the matching. Then they will accept this organ. Or if it is not matching, then organ is not accepted.
Yes. And when we were also talking about the non-eligible criteria, so until they get the organ, let's say liver, kidney, or lungs, so do they just follow the conservative management in terms of drug therapy and lifestyle changes and
Yeah,
maybe
yeah, yeah, yeah.
dialysis, chronic dialysis, they become.
Yes, yes, yes. Still, or look, till the organs are not available. Suppose they are probably they are listed on the transplant list, and they has to follow strict for like example, like for kidney, like the fluid intake has to be strictly restricted. They cannot overboard themselves with the fluid. Similarly, with the liver condition also. So the considering for liver, but they are on the list, but organ has not received. But they have to follow strictly what doctor has advised to them, including intake of the water, including intake of the salt, as well as medication has to be properly taken after consultation of the doctor only.
So regular follow-up and monitorings are required for
Is
such
important, right?
criteria.
Right.
Yes. So when we are talking about the process, is organ donation process influenced by a range of factors like we were talking about the compatibility and what legal and ethical considerations must be adhered to in terms of organ donation in general? Or we also should talk about the cultural and misconceptions, because many times whenever we talk, sometimes they say that it is about the cultural barriers and sometimes a general mindset of the populations. So what is your insight about this?
Yeah, that is absolutely true. Whenever like we counsel or we come across this kind of situation, the most of the time the attendant of the patient or a near dear relative of the patient, they are not aware of the condition
Yeah.
called as brain dead, where we can retrieve the organs. Living donor is different. That is probably it is more commonly happening. So that part is set aside. But this part where we can have organ donation in brain dead situation, this is totally probably lacking because of maybe not much of understanding among the common people, and also not much of orientation in that part also. So first thing, when we genuinely approach to a family or any attendant to the first thing is that they have a doubt regarding the intention of the like doctor or the like. So but like after frequent counseling and all, when they do know the situation of the patient, that it is probably it is not going to reverse, then they do accept.
Yeah.
On top of that, if you consider, if you counsel this kind of patient, many times the immediate next kin is not the decision maker.
Yes.
So probably those who are the providing probably the finances, probably in this many situation, the maternal uncle or paternal uncle, who
Yes.
may be the main decision maker, and what his understanding regarding whole disease process is totally different. In top of that, if you see our cultural aspects also, sometimes religion factors also do play
Yes.
an important role. Some of the religion might be or may not be, what are the details. So because of that factor also, the donation part is totally neglected, or they are not ready for the donation. In sometimes in rural areas also, they are their fear that if you take, or if you take, and there will be cut disfigurement of the body, and this patients the last ritual or funeral is not accepted in their society. So
Yes.
that cultural, that taboo is also there in our society. So all this cumulative, that they are the hindrance probably in our proceeding with the organ donation and counseling for the brain death also.
And sometimes they connect it with the spiritual taboos as well, as
True,
you
true. Yeah,
discussed.
yeah, definitely, definitely.
Yes. And when we are talking about the types of organ transplant, would you like to tell mostly about the post brain stem death, which I was also hearing right from in the beginning of the slide? Can you just tell us about the
Yeah,
post
so
brain stem death?
what happens is we actually follow the UK guidelines, UK pattern of the declaration of the brainstem death. So what happens is whenever there is a permanent irreversible brain damage because of whether it may be severe traumatic brain injury, or it may be ischemic stroke, or it may be any severe intracranial hemorrhage or subarachnoid hemorrhage, where there is a uh, permanent and irreversible brain is damaged. So in that situation, what happens is the other organs also start failing. But these kind of patients, they are ventilated and they are on the close monitoring. So these patients, the organs give us time, so that if we maintain this organ, and if the family is accepting, these organs can be transplanted in the respective or eligible donor. So this
Yes.
set of patients where we'll tell as a post brainstem death. Many the other form of a post circulatory death. What happens is, suppose a patient comes to the casualty in the arrested state, even if adequate time of CPR has been done, but we could not achieve a spontaneous circulation. So in that situation, like up to probably 6 to 8, probably period of time, maybe 6 hours, there we can have a time window for the organ transplantation, but that depend upon the again warm ischemia time. It varies. So if the warm ischemia time is going beyond probably 60 to 90 minutes, then the organ may not be eligible, or the outcome may
Viable.
not be good if you
Yes.
transplant that organ. So
Yes.
this subset, this is the second set where of set of patients where we can consider them as a transplant, that is post circulatory death. The living donor, yes, definitely. When suppose like in the family or near dear relative, if they are actually typing, if their matching has been done, then this is a living organ donation. This is commonly happening. So this type of organ transplant, this probably three type of organ transplant we can consider.
So now when we go for organ allocation, and also we follow few scoring system, I think primarily, which has to be a little spoken. So these the scoring system which one should adhere to. So
Yeah, yeah, definitely. So whenever a patient is being registered in this is registry is maintained by the state government or any body. So like in Telangana state, Jivandan has
yes,
registry. So what it does is, suppose a patient is having end stage kidney disease, he's been dialyzed for longer period of the time. So if he is entered in the registry, then there is a scoring system has been followed. How much time he is on the dialysis, what are the complication he is facing during the dialysis, how many times the fistula failure has been happened, what are the age of the patient, and since
patient.
when he is on the waiting list. These are the certain criterias, along with the blood grouping and HLA typing has been done, so they were given a preference. Similarly, if you go on the Jivandan website, everything is been elaborated and very well written for every, like liver also. Suppose this patient is requiring liver, patient is having CLD, he has had land having frequent complication because of chronic liver disease, has been frequent hospitalization, then the patient, this kind of patient has been probably given in the preference in the registry. So everything is been properly monitored and very well governed, so that those who are properly eligible, these only patient will get the organs.
So very clearly explained by you, sir. Thank you. And when we are talking about, until I think I was not aware of this regulatory guidelines, and was not even knowing that these kind of regulatory state, regional, and national guidelines do exist. So when we are talking about this National Organ and Tissue Transplant Organization or amendment or act which we follow for the state and regional, so what about their legal framework or the purpose? And also the main aim is, again, it is highlighted that commercial dealings in human organs also to be, looked into this. So would you just give your insight on
Yeah,
that?
yeah, definitely. Yeah. So, the once the our understanding has been better. So, in 1994, the Human Organ Transplant Act has came in 1994. Later on, it was modified amendment has been done in 2011 as well in 2014. So the now the Human Organ and the Tissue Act. So initially it is only Organ Transplantation Act. Then later on, it has been renamed the Human Organ and the Tissue Act. So it has been amended 2011, then 2014. So to increase the further awareness, to increase the further streamlining of the process. So every state, every region has been divided in equal zones,
Yes.
various zones. So NOTO has been set. That is the National Organ and Tissue Transplant Organization. It is a nodal body. It is the of like the body is situated in the Delhi. So national guidelines and maintaining a national registry as well as for the organ donor as well as the tissue bank has been created in the Delhi. So and subsequently there are total 16 regional bodies. There is called as ROTO. So it is a regional level organization, and then finally it is called as SOTO, that is the
Toto, which
state level.
is,
So
yeah,
at individual state, they will form they implement the prescribe the guideline, and they will monitor and they will streamline the process so that their first thing is that those who are needy they will get the organs. The commercial dealing is totally is not possible because it is very tight and very monitored process,
yeah.
and it is very well conducted. In between, they have like frequent they do frequent workups also regarding community awareness program, regarding various training of the coordinators also, so that
Yes.
the percolation of the information will be more rapid and more widespread.
So in terms of state level, like as you said, we have Jivandan at
Yeah, yeah,
Telangana. Yes.
yeah, yeah.
So when we are talking about the Indian scenario, let us also a little bit see in the Western world what is happening. I think, and the few Western countries, as you were mentioning, Austria and Spain, I think they have a very good system to address organ shortages and to improve the donation rates, I think. So why it is so in the Western world?
So as we so there, if you see the in Western world, the percolation of the awareness among the community is far better as compared to the our Indian situation.
Population.
So every almost person or a layman is aware of the what is mean by organ donation. They are totally well aware of. There are frequent community programs are happening. Social media is actively taking part. The policies framework are very very friendly to the organ donation. Likewise, I think there are at like school curriculum or even in college curriculum, probably they might be get exposure to
It
what
is
is mean
taught
by
to them. Yeah.
organ donation and how noble the probably the cause is. And the infrastructure, I think, in the Western countries is definitely it is far like better as compared to our like
Yes.
hospitals. So though our in definitely in private sectors we have got very good robust infrastructure, but overall infrastructure like rural hospital and any district hospital, if you compare, the infrastructure is not up to the mark. I think in Western countries down the time from rural and probably in district sector to the teaching hospital, they have very robust infrastructure so that they could turn around the organ, the brain dead or probably the organ donors. Simultaneously, the cultural taboo or social taboo stigma is also less in that
Very less. Yeah.
society as compared to our Indian society.
Yes. Yes. And so when we were talking about this opt-in and opt-out system, I think this is very clear. I guess everybody gets registered and they do agree upon their death and they donate.
Yeah, yeah. So in Western countries, there is a tool called as opt-out system. Opt-out means there is a if the death happened, there is an implied consent. Implied consent. Suppose a patient has suffered like he has died, so there is a like they have authority, government have authority to take the organ unless the attendant refuses to donate the organ, or prior the patient who has already made a will that I don't want to donate. In that situation only, the patient or the particular person has been removed from the system. So that increases the contribution from the system. In our setup, it is opt-in system. Opt-in in, suppose any suppose a person makes a will that I want to donate organ after death. So then again, the immediate next skin has been like it is asked. If he says okay, then the donation will happen. So that opt-in system makes like obviously the number of the participant will be definitely reduced as compared to the opt-out system.
Yes. But in Indian scenario, after they opt in also, sometimes they, before the, death process, they deny, I guess.
Yeah,
Sometimes
yeah,
they
definitely. Then
deny
even
this.
if you consider like even if opting like whatever the system also, the again the what are the social taboo, what are the cultural background, what is the location, and location in the sense where the patient is from, the attendants from rural background or the urban background, or the probably the who is the like funding the treatment.
Yes,
They have like many times you might have noticed a particular family has a family head,
yes,
so he may not have been sufficient knowledge about the system, what is happening. So whatever been, whether it has been right or wrong, it has been followed in the particular family. The same in the it is in the small villages also. Suppose one particular patient has been admitted. So probably what is the village head or the sarpanch decides that has been followed by the family. This is one of the difficult tasks in our society.
and these are the influencing
These are
factors,
the
I
yes,
think,
yes,
and
these
it
are the
delays the
influencers.
donation process. Yeah.
Yes.
So as we were talking about SOTTO, which is again your our state of tissue transplantation act. Again, we have very beautiful portal and very informative portal, which is Jivandan portal, and it is the initiative by government program is on cadaver for the cadaver transplantation. And what is actually its aim, sir? We still
So,
would like to understand.
the Jeevan Dan, it is a Telangana State cadaveric transplant initiative. It has been, I think, if I am right, it has been formed around 2010 and 11. It has the all these are the linked registered hospital.
Yeah.
So the every of the whatever the donation and or everything is happening under the uh, Jeevan Dan and all. So it will has a it will. Encourages the community aware, increases the awareness in the society, does a frequent seminars, frequent community awareness program in various community levels. It closely like monitors and it maintains a proper registry who was donating the organs. Simultaneously, it promotes to active like being a active donor, pledge for the organ donation, so that this person can be future in case if they like die or something, they will be and the organ donor. So it is a very noble and very what do you say? The Jivandan Society is doing a very phenomenal. So after that, you see the graph of probably organ donation has increasing. The community awareness has been increasing in the state of Telangana.
So one must has to be registered if they are the receiver or donors in terms of portal from Jivandan.
Yeah, yeah. So donors, you can go to the portal and you can register yourself. You can pledge for the. If you go to the portal, then you have to fill up in your basic details, and ultimately you have to like then which organ also you want to donate. That has the option is also there. So you can submit and you can register yourself as a potential donor probably
Donor,
in
yes.
future if something happens.
So this is, I think, homepage of our Jivandan Cadaver Transplantation Program, Government of Telangana. It is very accessible website. Everybody and every individual should access, gain the information, register for organ donation. I think, sir, you will also agree with this.
Yeah, yeah, definitely. If you see the left-hand side, they have very well elaborated what are the events. You
Yeah.
see, if you click that, what are the
Yes.
upcoming the community events and all that has been shared.
Yeah.
The what are the trends have been shared. What are the guidelines has been followed. Everything will be shared, not only for the medical professional, not only that, you can go there, you can access, and in the finally, what are the myths and what are the
Yes.
social taboos? What if you can directly go there and you can yourself read that it is so well elaborately mentioned there, so that if you
So
read this particular thing, you most of your doubt will be clarified.
Yes, that itself is going to be, giving lot heaps of information. As we
True.
can see, the geo order, I think whatever, timely change of order also, I think they publish in the website.
Yeah, yeah, yeah.
Yes.
So any recent information, any change in the guidelines, anything will it is available in the notified. On top of that, those who are already donated organ, they are been felicitated as a hero, society hero.
Yes.
They
Yes.
will family will receive a certificate for that. They
And they're
appreciating their
honored.
contribution.
Yes. So this is the article which I could found out in the website, and we was just going through it by the with the paper also. Like Telangana gets best state award for highest organ donation, and if you could see the statistics also, which was which is again projected here. So I think you will also agree with this because state honored 143 donor families on this 3rd August. So this is very great
Yeah,
initiative.
yeah, this is a very
And
exciting and very good thing.
markable,
So yeah, so
markable,
what
very
happened was
markable.
I like when I was going through the literature, last couple of years back, Telangana was not in top. Last 2 years, Telangana is really in the top spot. So previously, Tamil Nadu state was there. Then with the continuous contribution from Jivandan Society as well as other linked hospital, so the our donation rate has significantly increased. So last 2 years, probably this is our state is in the top among the India in terms of organ donation.
So we'll continue to reach it to the higher altitude, I guess,
Yeah,
with
yeah,
these
yeah.
campaigns and with the productivity sessions which happens.
Yes.
Again, 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 we would like to highlight on the efforts of government and various healthcare organizations are also continuously working to address these challenges, as we have spoken about all these regulatory bodies and I think you will also agree that awareness campaigns on the social media, if at all we wish to amplify the information. I think these are the information which should be, launched. Otherwise, the public will not know what is happening in the society. So we at Yashoda, we also take part in the awareness campaigns at Yashoda for instant connectivity. If you can just see the creativity in terms of all vital organs, and I think the awareness is very important. We do have podcast, health talks, mega conference. And sir, you would wish to add any more thing which
Yeah,
happens with us?
definitely. So in Yashoda Hospital, we do frequent podcast regarding the how the importance and
Yes,
regarding the awareness at various society as well as in the even if in like medical fraternity also there are a lot of hindrances, a lot of knowledge gaps are there. So
yes.
we frequently try to address this. So in various small centers like small hospital also we do frequently visit there and we share our knowledge what is currently what is happening and which patient we can the awareness among the community or society how we can increase the awareness that is we frequently do.
And the mark of patient testimonial and patient experiences also is very, very important.
Yeah.
And we have come to the end of the session. I think we all are doing very great, wonderful work for the society, but we should pledge for organ donation. Everybody should pledge. And sir, a conclusion note from your end, and then we end the session.
Yeah, so as you rightly said, apart from awareness, the pledge for the organ donation and the change should happen within. So that is a like to highlight because if I already pledge for organ donor, I will encourage my family members. Okay, those who are real distant, those who are near and distant relative, I should be teaching at least encouraging 4 5 people to donate to pledge as a donor.
Yes,
Similarly, any staff is there, they should be pledging for themselves. They should pledge and they should be encouraged their near dear relatives to be
yes.
pledged as an organ donor. That's why the society will become more and more aware regarding these things.
So coming 13th August, again, we are going to observe World Organ Donation Day. And thank you for your valuable time, sir. We all are happy to have you here, and we look forward to have more session. Thank you, sir.
Definitely, definitely. It is my pleasure and it is nice interacting with.
Thank you, sir.
Yeah.